All right, we can go ahead and begin. So welcome everyone to today's session. Today we have Samantha Farella, and she is a dietitian, and we have her aboard today for Nutrition Awareness Month. So thank you so much for joining us today. All right, we can go ahead and begin.
Ooh, yay! Thank you so much for having me. I'm so excited to be here. I'm so excited to talk about becoming a dietitian and answer all your questions. So I'm just gonna go right here and jump right into the presentation. I'm gonna share my screen, and then any questions you have, you can just type it in the YouTube and I'll be able to answer them either throughout the presentation or at the end. It just depends, whatever flows best for me. So I'm gonna head and share my screen and then go into present mode. I hope everybody can hear me okay. I hope everybody can see this okay. All right, awesome. So being a registered dietitian nutritionist, I am so happy to be here. I love what I do. So I basically do the same thing in different areas. I work for a private practice. So I work under somebody who I deal a lot with weight loss, PCOS, hypertension, hyperlipidemia, diabetes, prediabetes, GERD, IBS. And because this is private counseling where I work under somebody, I don't have much of a choice as to what kind of clients I do get because I work under somebody, which is awesome. I also have my own online business, Nutrition with Samantha, where I do kind of the same thing, where I'm counseling clients, but it's basically my ideal client. So I kind of screen who I want to work with. And my ideal client is really somebody who has been struggling with weight loss for a really long time. And they've been somebody who is cycling through diets. They can't seem to get themselves off of diets. So I really help and come in to help them stop dieting, lose weight if that's what they want to do, and really develop a good relationship and a healthy lifestyle. So when I work for myself, I really get to hone in on actually who I want to work with. Like for myself, for example, I don't see a lot of IBS. I don't see a lot of GERD because it's not really what I'm seeking out. If they have it, fine. I hope that makes sense to you. So what is it like to be a medical profession in my field? So what I do, counseling, I get to talk to a lot of people. It's super rewarding. And I have a lot of people who I connect with on a personal level. I don't know if anybody in the room has had a connection where they had to counsel people or really give advice. It's really rewarding because what you're doing and what you're saying, the advice you're giving is really helpful to them. So it's super rewarding to see, their A1C go down, their glucose levels go down, and to just see them really reaching their goals, super rewarding. And it's also really flexible. What I do, I'm going to go into a little bit other jobs for dietitians, but what I do specifically is really flexible. I basically make my own schedule, and the boss that I do work for, the private practice that I do work for, is really flexible in if I need to change my hours or I need to shift some clients around. So it's really flexible, and I love having that flexibility and kind of living that flexible lifestyle. So like I said, as a dietitian, you can actually work in a lot of places. Most people know us in a hospital setting, so in a clinical setting, nursing home, in a renal dialysis center, corporate wellness, private practice, which is what I do, grocery stores. I'm from New York, so in a lot of grocery stores here, we have dietitians. Also in schools and in communities, gym and fitness facilities, and food service as well. And each of the dietitians in these fields are very different. So a nursing home dietitian does a little bit of a different work than me. Their client, well, not their clients, but their population there is, geriatric. That's an older population. And like gym and fitness, that's a way different population than people that are in a hospital setting. So there's a lot of different areas where you can work. So a little background, if anybody was wondering about schooling for a dietitian. And I get this question a lot, what's the difference between a dietitian and a nutritionist? And hopefully I can answer that question. we have to take a specific set of courses that are outlined by the AND, or the Academy of Nutrition and Dietetics. And this is usually completed in an undergrad or a graduate level. And I'm locked in, so I don't have to do this, but people under me starting in 2024, they have to have a master's to actually sit for the dietitian exam. So that was something new that came out probably 1 or 2 years ago. And then we have to apply and be accepted to a dietetic internship, which is a 1-year internship where we go through hospitals and nursing homes and really get that kind of like shadowing experience. And then that dietetic internship makes us eligible to sit for the exam. So say if I went to school and I did all of these courses outlined by the A&D, and I didn't do the internship and I didn't take the exam, obviously, I wouldn't be a dietitian, I'd just be a nutritionist. So a lot of people take a few nutrition courses, or they do a lot of research online, and they'll just qualify themselves as a nutritionist. As a dietitian, you have to complete a certain amount of hours, a certain set of courses by the A&D to actually qualify to sit for the exam and then pass it. As far as schooling goes, what kind of classes do we take? We do things like medical nutrition therapy. This really sets you up to work in a clinical setting. And although I never worked in a clinical setting, I had to intern in a clinical setting, it really helped me background about every disease that I've ever encountered. So like I'm talking GERD, IBS, PCOS, obviously diabetes, hyperlipidemia, hypertension. So medical nutrition therapy is really helpful for that. Chemistry, orgochem, biochem, anatomy and physiology is a big one, and one of my personal favorites, microbiology, statistics, psychology. And the psychology really comes in handy when you're doing counseling and coaching people. So that was one of my favorites. Medical terminology, obviously we have to be able to read doctors' handwriting, number one, but we have to be able to read their, terminology, their shorthands and all that stuff. So medical terminology was a really fun one to take. And then obviously just foundation nutrition classes, talking about vitamins and minerals and the body, metabolism, and all that really fun stuff. As far as what I personally see on a daily basis, this is going to differ from a dietitian that obviously works in a nursing home, but I see a lot of people who are looking for weight loss. And along with weight loss, I'll see a lot of metabolic concerns. I'll see metabolic syndrome, diabetes, hyperlipidemia, hypertension, PCOS, and all these things really coincide with weight loss. I'm sure you can see that. And also people come in just to improve their lifestyle. So maybe somebody's not looking for weight loss. They don't have any of these symptoms or any of these underlying conditions, but they know they're just not a healthy individual and they want to improve their health. So that's really what I see on a daily basis as well. Like I mentioned before, there is a lot of flexibility in what I do. So working for a private practice and working under a really awesome boss allows that flexibility. And then myself, I make my own schedule. So like I said, I'm all virtual pre-COVID, and I make my own schedule. I schedule my own clients. So I can average, just depends how much I want to work. I can average anywhere between 30 to 40 hours of work a week. And sometimes it's more than that. Sometimes it's less than that. It's really awesome because I could change it if I want. So for instance, my friend just asked me, she wants to take a trip somewhere. And I was like, all right, let me move some clients around. So that week I'll probably work less. And I just fits my lifestyle so much. I love that flexibility. So if you're somebody who likes that flexibility, likes coaching, likes motivational interviewing, which I'm going to talk about, working in a private practice is really awesome. So a little bit about what makes my job interesting and what kind of got me interested in this. I get different cases all the time. There's really nobody who is alike. And I do get to meet and connect with a lot of different people. And like I mentioned earlier, I get to really know clients on a personal level. And that's really what I love. I love to connect with people. I love to dive a little bit deeper. And I'm sure you can understand, if you're somebody who is into nutrition or anything, that food really connects with stuff that goes a lot deeper than just what's on your plate. So a lot of the times we're talking about like the emotional support, support. We're talking about family members and stuff that really influences people's food choices. So I really get to know clients, I get to know their families on a personal level. It's a really cool way to be able to connect as part of my job. So that's pretty awesome. I do have some case studies that I'm gonna go through with you guys, and I want to, I'm trying to see because if I exit this, I'm not gonna be able to see, I can't see the chat right now. Is there any way for me to see the chat?
Yeah, I think if you like go to the top of your screen, there should be like
oh goodness, I see it.
yeah.
Okay. Oh, all right. I think I'm just gonna put it off to the side, and then I'll answer all these questions at the end. I love questions. All right, so I'm gonna go through some case studies. So for instance, we're gonna have a 40-year-old female who is 5'4", 155 pounds. Her lowest adult weight, and I say adult weight because we really need to establish that this weight was in their adult years and not when they were, in college, because it really doesn't apply to adults. Highest weight 175, and their goal weight is 120. And the goal weight is 120 for her because she says that's what her BMI chart says, and that's what her doctor keeps telling her. And this is something big, and I wanted to put this in here. So the thing with this client in this case study is that she's been following a meal plan that I outlined for her. She lost 5 pounds, and she hasn't really seen any more changes. The scale has been fluctuating between 150 and 152. Her food choices, I see her food logs. I look at food logs really often. Her diet and exercise routine are consistent. She's consuming about 1,300 calories a day and has 4 days of moderate exercise per week. So if anybody, I'm going to keep talking, but where do you go from here, and what kind of suggestions do you give her? Do you change the plan? Do you change what you give her? I guess I'll just pause for a quick second. Something about the BMI, and if anybody is, working in a hospital, really going through the medical field, you will see a lot about BMI. And in terms of weight loss and the BMI, there's a lot of things that can influence BMI. For instance, muscle. So any bodybuilder that you see is going to be classified as overweight or obese. Clearly, physically, they're not, because they pack so much muscle on them, right? And it's not that muscle weighs more than fat, because that's not possible. Muscle takes up less space than fat. So you can have more muscle on you compared to fat. So you will look more smaller, tighter toned, but the number on the scale will never be at its lowest. So that's where BMI really comes into kind of being, a kind of a weird thing. So in this case study, her doctor wants her to be a low BMI, or, her BMI chart says she should be at a lower BMI. It's really, really individualized, and you really have to look at the person, their habits, and kind of how they live their life. If there's somebody who's going to the gym 4 or 5 times a week and they're actually lifting weights, then their BMI is never going to be within normal range, really, because they're going to have so much muscle on them. If you have any questions about that, let me know. It's something I'm super passionate about. But this client, that's a good question. This client, she's consuming about 1,300 calories a day. Something that I would do in this case is increase this calorie intake a little bit. This is a little low for somebody who is her current height, her current weight, and is exercising as much as she is. 1,300 is a low calorie range. So I'd probably bring up the calories just a little bit. And in terms of how much you increase it by, I always start with 200. I always increase by 200 and kind of see where that puts them. If they're losing again, if they're maintaining, I always increase it by increments of 200. That's just what I do, and what I find really helpful. Is it still case study number 1? Yep, so I talked about most of these, and I love talking about non-exercise activity. Thermogenesis is something where it's basically activity that you do that is beyond intentional exercise. So beyond going to the gym, so it could be, just daily movement, walking, how far you park your car, how much you're walking and moving throughout the day, doing laundry, cleaning the kitchen. These are all classified as NEAT, non-exercise activity thermogenesis, that burns calories that we have to take into account. I talked about BMI not being super, super accurate. And then always touching upon, with any weight loss client, I always touch upon non-scale victories. So non-scale victories, the number that's not on the scale. How are your clothes fitting? How are you feeling? Are you less bloated? Are you more energized? Are you sleeping better? These are all things that is progress and that are victories that aren't necessarily seen on the scale. Case study number 2. So I threw a male in here, 55-year-old male. He is 6 foot, 250 pounds. He has a history of pre-diabetes, hypertension, and high cholesterol. And he tells you he knows what to do. I know what to do, but he struggles to implement things and sticking with those things. What else would you ask him, and what advice would you give him? So right off the bat, these things signal to me pre-diabetes, hypertension, high cholesterol. These things are super diet related, very diet related. So that's the first thing that pops into my head. The first thing I do is always ask people, how familiar are you with your diagnosis? Sometimes doctors will just diagnose and just assume people know about diabetes or just assume people know about cholesterol. So I find it to be my job to kind of just go into a little bit more detail. Okay, like, what do you know about your high cholesterol? What do you know about your hypertension? What are your numbers? And kind of just go in there and explain how much that diet can really manage that. So this is a part where I call it motivational interviewing, where we're diving a little bit deeper. I kind of reflect the questions back to them. So you mentioned that you know what to do. You mentioned that you know what to do. You just have a hard time implementing it. So what does that look like to you? Tell me a little bit more about what you know what to do, and kind of put it back on them and just see what they say, see what's in their head, see what they're thinking that they have to do since they know what to do. And motivational interviewing is really, really helpful when you're counseling and when you're doing private practice, because it's an evidence-based approach to behavior change, which is so helpful to help people make changes. Because I love what I do, I can't make the changes for people. So part of my job is doing motivational interviewing and having people come to their own realizations, like their aha moments, like, yes, I can make this change. This is a change I need to make. This is what fits my lifestyle the best. And for somebody with prediabetes, definitely focus on consistent carbohydrates. So eating consistent carbohydrates throughout the day, not eliminating them. We don't want to eliminate them ever. And more importantly, putting an emphasis on balancing his carbohydrate intake with protein to reduce blood sugar spikes. Also healthy fat and fibers help with that as well. So looking at food logs is really helpful for that. I'll have clients record their intake. Case study number 3, 31-year-old female. She's 5'8", 284 pounds. She has a history of diabetes, fibromyalgia, PCOS, and she's not on any medications, and she's not interested in going on them. And this is something that I'm seeing way more frequently, especially with the younger-ish crowd, between 28 and 35, that they don't want to go on medication. So what? Oh, I'm sorry. So what do we do here? I like to find out, when were you first diagnosed with diabetes, PCOS, fibromyalgia, and obviously dig a little bit deeper into what you know about diabetes. What do you know about PCOS? I really like to empower people to know about their own body and what's going on in their body. Always want to make them aware of that. Symptoms, how is she currently managing without medication? What is she doing? Is it working? Is it not working? And then, because she's here for weight loss, we're talking about her fluctuations. So kind of what her, like I said in the beginning, what their highest adult weight was, what their lowest adult weight was, how they got there, what kind of diets have they tried, what worked, what didn't work. And a lot for PCOS. PCOS differs from client to client. What I see works really well. Dairy and gluten are very common inflammatory to the body. And when we pull dairy and gluten out of diets, with people who suffer from PCOS, inflammation goes down. Any kind of symptoms as far as the menstrual cycle goes really helps manage those symptoms, decrease any pain that's going on. Dairy and gluten free diets is really helpful for that. Like I mentioned before, for diabetes, consistent carb intake and balancing with protein, fat, and fiber to prevent blood sugar spike. And then fibromyalgia, anti-inflammatory food. So pulling out as much processed food as possible to really bring down the inflammation in the body and rotating in inflammatory foods, whole foods like whole grains, fruits and vegetables, and omega-3s that are found in walnuts, eggs, and salmon. As far as just some, little tips for you if you're interested in becoming a dietitian or pursuing a career in dietetics, the best piece of advice that I can give you is to get a lot of experience in the field. Start early, volunteer as much as possible. I worked for free a lot, but it really paid off because it gave me a lot of experience in a lot of different areas. And make connections, chat with as many people as possible, be open to job opportunities because the field of dietetics is very small. I live in New York and I've worked in multiple places and everybody knows each other. So it's really a close-knit community. So I would make connections, make a good name for yourself, and just be open to any job opportunity that you have because the first job you get might not be your dream job. I did not work in my dream job at all when I first got hired. It was something that I took out of school that, I wanted to learn a little bit, gain experience, but it really helped to set me up to where I am today because I made a lot of connections through that. So like I said before, it is very rewarding, but it can energetically be really tiring because I'm talking to people every single day about their struggles and their problems. So as I'm sure you can understand, taking on the other people's problems and struggles can really drain you. So I make it a point to be scheduling downtime, descheduling time where I can go on vacation. And that's why I like the flexibility so much. So I don't have to always drain myself and give myself so much because I can't perform that well. So scheduling downtime is really, really big and not feeling guilty about it. I think we all need to do that a little bit more. I am going to go to the questions. So if you guys have any questions for me, thank you so much for tuning in. I'm just going to go all up in these questions. I'm going to scroll all the way back up. Okay, first one. Do you think vegetarianism is a good way to eat? What are the biggest problems in this diet? So vegetarianism, I find that a lot of people become vegetarian to lose weight. That's just what I see in my experience. And it always backfires because a lot of people aren't educated properly about how to be a vegetarian and how to meet needs. So if you're going to become a vegetarian, I don't think there's anything wrong with it. You would have to do some supplementation because you're not eating certain things. So you do have to take some multivitamins and some other supplements to make sure that your vitamin levels aren't getting too low because you're obviously not eating those foods. The biggest problem with the diet, I would say, is that most people aren't educated to actually do it correctly. So they end up being deficient. They end up gaining weight because they go a lot towards carbohydrates. And not that carbs make you gain weight, but if it's the only thing you're eating, it kind of makes it hard. I hope that answers that. My first question is, what disease do you think is the easiest to get? My second question is, do you have a diagnosis test that you can perform on patients? I don't have any kind of diagnosis. I can't diagnose as a dietitian. So even if somebody comes in, this is really funny. This actually happened to me when I was interning. Their blood work would classify them as a diabetic. I can't say it. And if the doctor never said it, I can't say because I can't diagnose. So I can't do any type of diagnostic testing. And disease easiest to get, I feel like it would be anything related to general lifestyle. A lot of people just in general don't take care of themselves too well and they kind of focus on work or whatever it is. And I would say it's more like hypertension, high cholesterol, diabetes. I'm sure somebody in this chat knows somebody in their family or close friends who have those. So I would say those are the most common. Hardest part about becoming a nutrition specialist, I would say, is the competitiveness in school. super, super competitive to get into the internship program because they only accept a certain amount of people. Fun fact, I did not get in the first round, so I had to work for a year and a half, I think I worked for, and really got experience, which is great. I don't regret it, but it is really competitive to get into internship programs. I don't perform any surgeries. I do love Grey's Anatomy, but I don't perform any surgeries. And your main type of treatment, diet plans, and such. My approach is, I say, a balanced eating method, a balanced lifestyle, balanced plate. I never want anybody to feel restricted, but I also want people to keep their health a priority to them. So really helping people, incorporate their favorite foods in moderation. And a lot of that is mindset work. I do a lot of mindset work with clients, and helping them achieve their weight loss goals through that balanced eating style. What inspired me to become a dietitian? I was always interested in nutrition. I didn't know I could make it a career until I actually did it. I was somebody who struggled with not eating disorder, but disordered eating in a way of feeling bad and guilty about eating certain things. I would try a lot of diets when I was younger and just never have a balanced lifestyle where I was happy. So I really made it my mission to help women specifically stop dieting and stop living their life jumping diets to diets, and just live a healthy, balanced lifestyle where they can eat their favorite food, still lose weight, and just not be obsessed about food and not be obsessed about calories. Have you noticed any trends with people diets as COVID-19? How does COVID-19 affect your workplace? Okay, so COVID-19 affected my workplace because my personal business is all virtual. It hasn't really affected it that much. In the private practice that I work for, I no longer go into the office. So I'm on Zoom right now. I do everything with clients like this. Any trends with people diets? No, I haven't seen anything. I would make the assumption that the healthier you are, the more you take care of yourself, not only nutrition, but also mental space and mental health. I would assume that, getting COVID would decrease, but that's just an assumption. What foods or nutrients should women focus on in order to prevent hair from falling prematurely? What is the difference between dietitians and nutritionists? I hope I answered this question. I could review it really quickly, but hair loss can be for a couple different reasons. It could be PCOS. It could be an autoimmune like lupus where your immune system is attacking itself. It could be really high stress levels. But something as far as the diet I would focus on is making sure that you're having enough iron. So animal products. If you want to supplement, you can absolutely do that. And then also incorporating omega-3s and healthy fats. So something I mentioned was salmon, eggs, healthy fats like nuts, nut butters. Those are all going to have really awesome nutrients to help hair falling out. I answered some of these, so I'm just going to keep going. How will you heal the situation when patients don't obey the diet you make for them? Ooh, that happens a lot. That's a really good question. It's on them. It drives me a little nuts because I can only do so much. I can't do it for them. And I want to so bad. I want to help them. I want their A1C to go down. I want them to feel comfortable in their skin. At the end of the day, I can't do it for them. So I use a lot of motivational interviewing with that, kind of figuring out what makes this diet plan so hard for you? What makes it so hard for you to make choices that are in alignment with your goals? So I really put the question back on them, but that does happen a lot where people don't really do what they came to do, supposedly. Best part about being a dietitian is really helping people reach their goals. Like I said, it's super rewarding just seeing people smile, seeing people be healthy, very rewarding. I went through the schooling a little bit. Do you have any on apps that can help you track the amount of nutrients you take and should not pass per day? I'm not a numbers person. So I think that apps can create awareness, but I also think that it could make people really obsessed with numbers and with reaching their macros or staying under their calories. I think it could become an obsession, and I've seen it a lot. So something that I would really focus on to see, if you're getting the right amount of nutrients, one, you can go for blood work. You can kind of see if everything's in check. And then two, I love this question, really tune into your body and like be honest with yourself how you're feeling on a daily basis. How are your energy levels, how are your food cravings, how's your hair, how's your muscle strength. These things are really a great way to see if you're meeting your nutrients, because it's all about how you feel, right? And then any type of additional blood work would be helpful. To communicate with patients and my clients effectively, I use a lot of motivational interviewing. So turning the questions back on them and asking them, what do you think you can do better? What made you make that choice? And really diving deeper into the situations that's going on with them and having them answer their own questions is super helpful. How do you encourage a patient to continue a meal plan when they feel like giving up? How often do you ask patients to keep a food diary, if at all? Yeah, I do have my clients keep a food diary, and I always like to say it's not a life sentence. It's not something that you have to do forever, but it's really helpful for me to be able to see what you're eating. I'm a very visual person, so I've been doing this, and I can see portion-wise, visually, if what you're eating is enough, if it's not enough, if it's too much. And then when patients feel like giving up, that's really, where I become the cheerleader and where I have to motivate them in order to keep going. I really bring up to clients and patients like, why do you come here? Why are you working with me? Why did you even sign up to do this? What made you come see a dietitian? And bringing it back to their why and what made them start in the first place. That gets really lost in the process of working with a dietitian of why you even came here in the first place. You kind of forget, like when it gets hard, you kind of forget why you're here. So I think it's important to constantly remind yourself, and that's part of what I do with my clients. If nutrients are essential to our body, why are some people allergic to certain nutrients? How would people receive those nutrients? Really, really good question. So from my understanding, a lot of allergies can be environmental, they can be lifestyle, and they can even be genetic. I don't know if allergies, if they have a specific real reason why it happens to some people. There's a really cool, and I don't know if anybody's ever heard of this, there's a really cool method. I forgot the name of it, but they basically microdose with something that somebody's allergic to. So let's say peanuts. Somebody presented this to me about their child, that her child was allergic to peanuts, and they would microdose him. So very, very small doses, working him up to larger doses where now he's able to have peanuts. And they would microdose in a way where it wouldn't cause so this is the allergic reaction, it wouldn't cause an allergic reaction. So they would keep microdosing him and the allergic reaction tolerance would keep going up. It was super cool. And now he doesn't have the allergy anymore because his body got used to it. I think it's the coolest mechanism. I don't remember the name, but I know has to do with microdosing with whatever you're allergic to. So you can kind of reverse it in a way. I don't know too much. I don't deal with allergies too much, but that was a very interesting thing that I learned. What age group are most of your patients in? Really depends. My personal clients, because I pick them, I screen them, are anywhere between 25 to 35 years old. The private practice that I work for, I see people between the ages of 17 to 60 years old. So that one, I just am giving clients. I don't have to screen them or anything. So it's a really large range. Second question is, how do you feel about diets being trends on social media? I think that diets should be left to people who are professionals. And a lot of things on social media is for marketing, is for money, and a lot of people are doing things, to make an income. And I totally understand that. It could do more harm than good for some people. Have there any been different or wild cases that have come in? No, I haven't had anything really, really crazy. I had somebody who this is a kind of interesting one, who had pica, where she would eat powdered coffee creamer. Like she would sprinkle it on things and eat it. So that was just like something different. She would eat coffee creamer, sprinkle it. Do you use any computer phone programs to come up with the plan and monitor your patient's intake? Yeah, so I personally use a patient portal called Practice Better. I don't know if anybody's ever heard of it. Practice Better is a really cool app that you can download on your iPhone. And I type my notes on there for clients, and I also have them do their food logs. So when I do food logs with clients, I have them taking photos of their food, they upload it, and then when I'm on Zoom like this with them, I will share screens with them and I'll kind of go through their intake. And that's how I monitor their intake. Is it really true on how some people say that eating salad all day keeps you healthy, or is it too much of it not good? I think variety is really important. So eating something just because it's very nutrient dense every single day, I always want clients, even when they're eating the same vegetables every day, like, let's get some variety, let's get some different colors, because every color has a different nutrient. So we have like red and green and yellow and purple. All these different colors are different antioxidants that are responsible for different roles in the body. So I'd always want to make sure that you're having a variety of stuff. I hope that makes sense. I meet with my patients either bi-weekly or once a week, depending on what they want. And a day in a life of being a dietitian, like I said, there's a lot of flexibility. So for instance, for tomorrow, I am back to back with clients from 2 p.m. to 8 p.m. So that's just an example of one day. But like I was saying earlier, I can change as much as I want. Going on vacation with my friends, so I'm kind of going to change that up a little bit. But it's really cool that I can have that flexibility with patients. COVID hasn't really changed my lifestyle other than I'm working now on video chat with them. I don't see them in person. I haven't done a residency because I'm not a doctor, I'm a dietitian, but I did my my undergrad at Long Island University, and then I also did my 1-year internship through them as well. Yeah. Have you met people that force malnutrition upon themselves? I don't specialize in eating disorders. One of my really good friends does. So it's not an area of expertise that I'm super comfortable talking about, but I have come across it, and it's very, very individualized. And I feel that you absolutely need to have a background, you need to have experience with it, because it's definitely different. What type of illnesses do you see in your clients? Main ones are very weight-related things: hypertension, diabetes, prediabetes, cholesterol, PCOS. How long does it take to become a dietitian? So it obviously depends. For me, I changed my major. So for me, it was 6 years, but it should, I mean, ideally, like my friend was 5 years because she didn't switch majors. So I was 6. I meet with my patients weekly or bi-weekly. And COVID provided any significant obstacles with helping your patients? No, other than like their excuses, you know? I loved this question. I saw it pop up earlier. Are dietitians also trained in therapy, because food involves an emotional connection and probably needs a solution that is deeper than the surface? Yes, 100% yes. And when I did my internship, we had to take a whole motivational interviewing class, and this goes a lot deep into the emotional connection. And honestly, I learned a lot of it by doing it and just being a type of person that likes to dive deeper and can really connect. And that's why I said connection is really important. Being able to do that in this and have compassion and empathy really helps people open up and dig deeper into that emotional connection that they have with food. I love that question. Can dietitians specialize in certain diseases? Yes. So if you work in a hospital, you can definitely take on certain patients. I take on certain patients, certain clients in my online business pertaining to weight loss, diabetes, cholesterol. And then there's also, there's renal dietitians, there's oncology dietitians, there's, trying to think what else, pediatric dietitians. So we are in every area. License renewal requirements is we need to keep up with our CEUs. I don't know if you're familiar with CEUs, but every 5 years, we need to have 75 CEUs to stay a registered dietitian. What is the most common mistake people make that cause them to fail at their diet? How do you determine what supplements a client needs? So, common mistake people make, underestimating consistency. So in order to see results, you have to stay consistent. And something that I learned is that people's perception of consistency is different. You know, my consistency is going to be different from yours. So what I found really helpful is quantifying what consistency looks like if they're trying to lose weight, bring down their glucose levels, bring down their A1C. You know, your decisions around food need to be made in alignment with your goals most of the time. So I would say it's consistency. That's where most people fail. And also mindset, they give up. How do you determine what supplements? I don't really prescribe supplements too often unless people come to me with blood work that says they're deficient in vitamin D. That's a big one. But supplements aren't a big thing that I'm into because they are not regulated by the FDA, surprisingly. So we don't really know what's in them. I'm sure some brands are more reputable than others, but I truly believe that you can get everything that you need through diet unless you have some absorption issue, which I would look at blood work for. Specific diet that helps with acne. Not something I have too much experience with, but what I've heard is keeping inflammatory foods out. So dairy can be really helpful, gluten could be helpful, but it really depends on person to person. And obviously drinking a lot of water and a lot of fruits and veggies in your diet. Do you perform tasks only related to your specialty, or do you do other generalized physician work? I don't do other generalized physician work in terms of, I don't know if you're talking about working with a doctor. I used to work with a doctor, like work side by side in a bariatric, a weight loss center, but I don't do that anymore. Cases that I find really interesting, cases that you found difficult. I can't think of any off the top of my head. That Pico one was different. Do you work with any doctors, therapists from other specialties, or refer patients to them? I don't work with any doctors. I do have a few therapists that I know of and that I refer to if needed, because like I was mentioned before, super emotional connection. And there have been times where I say to clients, you know, this is a little bit out of my realm. Do you have a therapist to speak to? Because it's a lot of emotional stuff. It's a lot of like family influence on eating and on nutrition. So really that's something that isn't part of my job description, although I do it kind of often. A therapist is way more trained than me to dive a little bit deeper in that area. Would you recommend a plant-based diet, especially for those who suffer with allergies? Can dairy trigger allergies? Not that I know of. And what would you recommend a plant-based diet? I think plant-based diets could be good if you do it correctly. Like I said, a lot of people aren't educated on it and they don't do it the right way. And then they end up becoming malnourished. They don't have enough nutrients. So I think if you're educated on it and you consult a registered dietitian that you want to do, a vegan diet, I think it can absolutely be done in a safe and healthy way. How do you encourage your clients to take on intuitive eating after their time with you is up? How do you encourage your clients to take on intuitive eating after the time with you is up? So a big thing that I do with clients is, I work with them in the time to, help them lose weight and really adopt a healthy lifestyle and healthy habits. But I also set them up for success for their future. So I do work with clients for an extended amount of time, sometimes 11 months, sometimes for a year, even over a year, where people are seeing me way less frequently, but the accountability check-ins could be really helpful. So, and as far as just maintaining their results, I truly believe it's about educating them and empowering them. So the difference between what I do and what a diet does, or what anything you see on social media does, is I don't just tell clients what to do. I educate them and I empower them to make their own decisions. So far after we're working together, they can make their own decisions around food and really maintaining their goals. So that's, staying within healthy weight range, staying within healthy glucose range, cholesterol, hypertension, all that stuff. I really empower them to do that on their own. And during our, 7 months to a year of working together, I help them reach their goals, but also educate them in a way where they can maintain those results. Such awesome questions. Thank you so much. Oh my goodness, I feel like I did so much talking, but that was really, really great.
Yeah, thank you so much for all the great information you gave us. The case studies were actually really interesting too. I definitely learned a lot personally. Yeah, so that was a really great talk. Thank you so much.
Thank you.
There's also one more question from someone, if you can answer that one really quick.
What might cause a dramatic drop in B12 levels? So B12 is primarily found in animal products. So I see if you're a vegan, you have to supplement B12 because B12 is only found in animal products. So foods that would help raise it is really any animal proteins like eggs, chicken, turkey. Yeah, mostly those kind of items would help raise B12 levels. There could be other reasons why it dramatically drops. I commonly see it with vegan diets, but yeah, I hope that answers your question.
All right, perfect. Thank you so much. And for everyone who is still out there, the Google Forms link is posted, so it'll be due at 8 p.m. So be sure to get that done. But yeah, so thank you so much for being here with us today.
Thank you so much for having me. This was so much fun.